Unsung role of pharmacist. Though physicians have been considered as prime healthcare professionals field of medicine and public health, but there are and other healthcare professionals without them the proficiency in the field of health cannot be achieved. They are the unsung heroes, pharmacists. No doubt the diagnostic ability of the physicians is important for a patient health maintenance. But at the same time that dispensing of the proper medications is much more important for the treatment of disease. The only master of drugs is the pharmacist. It has been seen that the problem related to the medication's errors is increasing day by day. The role of pharmacist in dispensing of drugs has become a need of time these days. The field of medicines would remain incomplete without the role of pharmacist. The problem of drug interactions and inappropriate drug administration is also notable due to the paralyzed role of pharmacist in patients' health. The diminished role of pharmacist is due to traditional attraction of patient towards physician. The other problem of the extra medications to the patient without knowing the drug-drug interactions, which can also result of inappropriate medicine. According to recent research which was published by JAMA Publishers narrates that 66% of the geriatrics receives more than 5 medications per day and 25% patients is more than 10 drugs per day. The increase in number of the drugs, the chances of drug interaction can significantly increased. Due to the increase in the number of drugs, the chances of adverse drug reactions may also increase much more. This problem highlights the role of pharmacist in the field of medicine. The other main reason of need of pharmacist is that the physicians have not enough knowledge about drugs. They also have not enough time to deal the adverse effects of the medication in different patients. They don't know the drug interactions and adverse drug reactions. The lack of knowledge of physicians regarding drugs has increased the importance of pharmacist in the field of medicine. People usually focus on traditional doctor and patient interaction. They don't allow the pharmacist to enter in their traditional concept of health. Government should apply specific policies to promote the role of pharmacist in health department. The role of pharmacist is also well versed in designing dose frequency, duration and route of administration of medication. Pharmacist knows about the medication and their proper interventions. Without pharmacist, hypersensitivity due to inappropriate drug has been increased day by day. The prominent increase in drug interactions and adverse drug reactions results due to the diminished role of pharmacist. Drug without indication and indication without drugs errors will also be increased if the role of pharmacist remained cut off. Interventions by pharmacist will bring the improvements in patients without using extra medications. The decrease in number of medicines is much more important in reducing the drug interactions. By concluding my point of view, it is mentioned that pharmacists are the vital part of health department. Without them, the life-threatening conditions caused by the medication errors cannot be resolved and proper treatment of disease cannot be achieved.